Do you think that there will be a cure in your lifetime? And what encourages you the most about what you've seen with the research?
I would have to say I think there will be a cure one day. In my lifetime, I don't know, because the medicine has grown so much. 20 years ago when I announced there was one drug, AZT. Now you got over 30 drugs, and the drugs have been gotten better and better and better. And so it's easier to take them now. 20 years ago, it wasn't easy to take them.
Hey, my name's Courtney Forehand. I'm a nurse practitioner student at Auburn University. Today I'm going to be talking to you about a drug class, protease inhibitors. They are an HIV drug class, and so I'm going to tell you a little bit about them. Protease inhibitors include fosamprenavir, lopinavir, darunavir, tipranavir, ritonavir, atazanavir, nalfenavir, indinavir, and sequinavir. The rational drug selection is sequinavir, ritonavir, and fosamprenavir. So the mechanism of action, the HIV protease works by cutting up long chains of the virus proteins and enzymes into smaller pieces that go on to infect new cells. Protease inhibitors bind to the HIV protease and prevent the enzymes from cutting up the viral protein molecules into their correct sizes. This means that the virus cannot go on to make new copies and infect new cells. The inhibitors bind to the enzyme much more tightly than the natural substrate, and the protease inhibitors slow the virus production in both newly infected cells and cells that have been infected for a long time. Some therapeutic effect, they're antiviral drugs used in treatment of HIV and hepatitis C. Protease inhibitors reduce the viral load in HIV and AIDS to very low levels and reduce the risk of opportunistic infections. In hepatitis C, that virus protease inhibitors can actually cure hepatitis C, and these medications, they're much more effective than other hepatitis C treatments. So some pharmacokinetics, it's absorbed in the GI tract and first pass metabolism by CYP3A4. It's distributed in the blood and metabolized in the liver by the CYP450. Excretion is in the feces and in the urine. So some pharmacotherapeutics, it's precaution in hepatic impairment, hepatitis B or hepatitis C co-infection, structural heart disease, cardiac conduction disturbance, ischemic heart disease, cardiomyopathy, and diabetes. It's contraindicated in hypersensitivity and hemophilia. And there's a black box warning for ritonavir. It can cause serious and or life-threatening reactions if used in combination with certain sedative hypnotics or antiarrhythmics or ergoalkaloids due to inhibited drug metabolism by ritonavir. Some adverse drug reactions, it's going to change the way food tastes. It'll have fat redistribution, diarrhea, insulin resistance, hyperglycemia, high cholesterol, high triglyceride levels, liver problems, nausea, vomiting, and rash. Protease inhibitors may have many drug interactions because they affect the action of liver enzymes. This may alter the effect of the breakdown of protease inhibitors in the liver. CYP3A4 is responsible for the metabolism of protease inhibitors with slight activity from CYP2D6. This is also responsible for the metabolism of a wide spectrum of drugs. So some of the drug interactions would be uroxetrol, doxazocin, rapaflo, tamsulosin, Viagra, Cialis, warfarin, simvastatin, lovastatin, amiodarone, ketoconazole, itraconazole, fluconazole, clarithromycin, erythromycin, fluoxetine, carbamazepine, phenobarbital, phenytoin, rifampin, and St. John's wort. So some patient education, administration. Before starting a medication regimen, patients should have resistance testing done, as well as a review of clinical symptoms and a history of antiretroviral use. Some lifestyle management. Patient must take all medication as prescribed in order to suppress viral load, and close monitoring of other prescription over-the-counter medications to evaluate possible drug interactions. Patients must be compliant with follow-up testing of viral load as well as liver function, cholesterol, and blood glucose. Encourage good nutrition, avoid raw eggs and unpasteurized dairy products, and we must provide a non-judgmental sex-positive prevention counseling. So monitoring, you're going to want to monitor liver function at baseline, then 2 to 8 weeks after start of medication or change in medication, lipid profile at baseline, and then every 6 to 12 months, fasting blood glucose at baseline, then every 3 to 6 months as indicated, CPK, uric acid at baseline, and then periodically. So some main takeaways. The main purpose of HIV is to copy itself as many times as it can. However, HIV lacks the machinery to do this. Instead, it injects its genetic material into immune cells in the body called CD4 cells. It then uses these cells as a kind of HIV virus factory. The protease is an enzyme in the body that is important for HIV's replication. Protease inhibitors drugs block the action of protease enzymes. This prevents protease enzymes from doing their part in allowing HIV to multiply. In this way, protease inhibitors can interrupt the HIV life cycle. This can stop the virus from multiplying. So the emergence of protease inhibitors has revolutionized therapy for HIV, increasing life expectancy in these patients. The drug's effectiveness and the patient's clinical outcome are dependent on the provider's ability to properly administer the drug and the patient's compliance to the drug regimen. Optimal dosing is required to maintain antiviral efficacy and prevent the appearance of resistant strains. Therapeutic drug monitoring of HIV, RNA, CD4 counts, and protease inhibitor levels assist the management of therapy. Drug adherence failure is the most common treatment failure, and protease inhibitors need to be taken along with other medications to treat HIV effectively. To be fully effective, almost all protease inhibitors need to be taken with ritonavir or corbistat. And that's all from my presentation. Thank you so much for watching.